Good afternoon. We have Dr. Torres from the OB clinic. He's showing us how he always washes his hands before every visit. What other measures do you take before the visit and during the visit to keep our patients safe?
Hi, how are you? My name is Dr. Torres. I'm here in OB, in our women's side. We are taking very much care to try to avoid, spreading this virus and try to protect our patients. We are, following the guidelines of hand washing, distancing if there's no need to check the patient. We are washing with water and soap or using the hand sanitizer with every patient, usually before and after each encounter. We are trying to, help diminish the spread of this disease by trying to do certain visits by telephone visits or telehealth, so the patient doesn't come unnecessarily to the clinic and get exposed. So unless the patient needs to really be seen, then basically we will see them here. But as you see, we are wearing masks to try to avoid the spread of the virus.
So you have the patient come in for their visits when they're pregnant, for the prenatal care, and then once they have the baby, they're supposed to come for or have any kind of postpartum visits. How do you handle that?
So we like to have 2 postpartum visits for each patient. Usually we do one 2 or 3 weeks. Now that the virus situation is going on, we try to do that visit by telephone, by telehealth, to try to decrease the exposure to the patient. Unless the patient is having any postpartum problems like any infection, any mastitis, or any other issues, definitely that telephone visit can be done over the phone. We usually like to check for postpartum depression. We usually like to check if the patient is having any issues soon after the delivery, and also we check to see if the patient wants to do any type of birth control to try to avoid getting pregnant too soon.
Okay, so that visit is over the phone. So after that visit, do they have to come in?
Yeah, normally we like to see the patient 6 weeks postpartum, but with this situation, we are extending that to 6, 8, or 12 weeks, depending on the patient's situation. If the patient wants to have an IUD or a subdermal implant, we may tell them to come in a little bit earlier than that, so we can, provide them with the contraception they want. But if they want pills or they don't want any contraception or anything that can be done over the phone, we can extend that visit to almost 12 weeks postpartum to try to keep them safe, and hopefully this viral situation will get better by then.
So by not having as many visits, then we're having less people in the clinic. So we have, you have less chance to run into people that may be sick.
Definitely, since there's a lot of patients that may not have symptoms when they are sick, that way we're trying to decrease the exposure. But even if a patient comes sick, we try to identify that patient and separate that patient from the other patients. That way we try to keep our patients safe completely. And those patients are going to be handled quickly to try to decrease the time those patients that may potentially be sick are the less time. If a patient has fever, definitely that patient will not be close to any other patient that is completely healthy.
Great. Thank you, Dr. Torres. I think the patients can feel safer now. Thank you.
You're welcome. Thank you.